Hi, this is Dr. Van Rieken at Reno Sparks MedSpa in Reno, Nevada, and I have with me Raj today. And Raj is somebody that works with paper in his work, and he can get the paper kind of moist because he's kind of a sweater in the hand area. Is that really where it's bothered you the most over the years, the hands?
Yeah, absolutely. From writing, shaking people's hand, playing tennis. I need dry hands, and so far, Botox seems to work the best.
All right. And so when you've gotten this before, I've been charging you under $900 for 100 units of Botox. How well has it worked?
So I would say, honestly, 100% symptoms improvement, where my hands are pretty much bone dry for several months after the procedure.
And then I remember the one time it was about 9 months between treatments. Now, after that 9 months, were you still somewhat drier than before the injections?
Oh, absolutely, yeah. Even when it started to wear off, it still improved from baseline, absolutely.
Okay, all right. And now, what have you noticed? You've been doing this a couple of years.
Yeah, about 4 years.
This is what, maybe your third or fourth time.
Yeah.
And how long since your last?
So the last time I got this procedure was June of last year. So we're looking at over a year. I'm thinking about 15 months.
So about 15 months.
Yeah.
And you still notice, even in 15 months now, it's a little bit drier than before the injections?
Absolutely, still a lot drier than it was before the injections.
How much drier, now we're 15 months out, how much drier do you think it is compared to before you ever started?
I'd say still 80% improvement.
Even
from
at
before.
15 months?
Yeah, even at 15 months.
So the first time we did it, it lasted about 9 months, so you think it's lasting longer per time?
Each time I do it, it definitely lasts longer.
Okay.
Yeah, absolutely.
So, and for those who are watching this video, I mean, how does it work? I mean, Botox does a couple of things. It can relieve pain, which isn't why we're doing this for him, but it relieves sweating. And basically, the sweat glands have a little muscular, smooth muscle around them they can contract. Now, they're very weak, tiny, almost microscopic muscles, so it doesn't take much Botox to get them. Now, if you get some NFL player who's got some big frown lines up here, big creases, you might have to put a whole lot of Botox in his forehead to get rid of those creases, because those are some big muscles. These are teeny muscles. Now, if you look at Raj's hands, I have marked him, and we have little dots here. And each phalanx, which is a part of the finger, the bone and everything over it, on the flexor side, you sweat more on the flexor side, and of course that's where it bothers you because you're handling paper. So we only inject the flexor side of the hands or the palm side of the hands, and then Raj, you find it helpful to do some injections over here on the sort
Definitely,
of
absolutely.
the butt of the hand, if you will. Okay, and so there are not quite 50 dots, but you can see that I've marked him. We already cleaned him, already marked him with a surgical pen. This ink will wash off in the shower. And I'm going to give him approximately just over 1 unit of Botox in all of these little areas. And let's hope we get another 15 months out of this.
Absolutely.
Now, this is drawn up in insulin syringes. So this is a 30-unit insulin syringe. And obviously, it's not insulin, it's Botox. But this is about 12 units of Botox. So there's about 12 pokes or so going into this. And so without further ado, we'll go ahead and inject, and we'll show this on Raj. Now, in the past, if 10 is horrible pain and 0 is no pain, what does the average poke feel like in terms of pain?
Probably around a 2. I mean, it just feels like a little prick. The needles are really small, as you know, and yeah, it's definitely not overly painful at all.
Okay. They are 30-gauge needles. These are diabetic syringes, so you can see the size of the needle compared to my finger. It's pretty small, not a real big needle. Okay. So we're going to divide this up into 50 units on each hand, and I'm going to stop the video at one hand, and then we'll of course do the other. And so we'll divide this up, and we're going to we have about 4 full syringes, and then just a little bit for this hand. You ready?
I'm ready.
Okay. Okay, and so 1 unit is going to be about half a graduation there. And still, would you say 2 or 3 out of 10 pain, Raj?
Oh yeah. Yeah, this feels like a little prick, nothing too painful.
And you see I'm not putting it very deep. You don't need to go deep. The sweat glands are pretty superficial. And you say, well, you know, you're not putting it every single spot. How do you get the effect? You know, this stuff diffuses for about 1 centimeter or so around it. So you don't have to get, you know, a poke in every single bit of skin. So what's the worst thing about this?
About the Botox?
Yeah.
It's actually not that bad considering the bang you get for your buck. So I gladly go through about 15 minutes of slight pain for 15 months of symptoms improvement.
Okay, fair enough. You know, we do have other techniques for sweat reduction in other areas of the body, like the infinity radiofrequency procedure is great for armpits. I've had that myself. It does hurt a heck of a lot more than Botox, but it is permanent. But you can't really do it on hands, unfortunately. And the reason you can't is that you know, you're close to nerves and tendons and stuff. When you do it in the armpits, you're kind of away from vital structures, and you don't have to go too terribly deep. But the hands, if you go as deep as you do in the armpits, you're getting into issues. So if you had heard about this years ago, before you had any,
Oh gosh, I would have done this so many years ago. Yeah, I had no idea about this procedure even existed until my first appointment with you. I would have done this all through school, all through playing tennis in high school, and all that.
did you play competitive tennis?
I did, yeah.
Okay, so that hand is done, and we'll go ahead and stop our video at this point, because the other hand is just a mirror image of what we've done. So basically, to summarize, Botox stops sweating or markedly reduces it for at least 6 months and up to over a year in his case. Seems to be a little bit more effective if you're doing it more often. Same as on the face. If you do it regularly on the face, those muscles weaken, takes less Botox to do the job, or if you use the same amount, it lasts a little longer. And pretty satisfied customer.
Oh, absolutely. Yeah, I definitely recommend this. So.
Okay, so this is Dr. Van Rieken signing off for Reno Sparks MedSpa. Stay dry.